I've been a social worker for a long time. These days right now, I see students with significant anxiety, stuck in depression, self-harm, no coping skills. They need someone to help teach them those coping skills.
The pace of the life they live, the fact that students live in social media, there's nothing that's private, there's nothing that is really protected in their lives right now, so they're so vulnerable.
Teens in particular get brushed aside a lot when they're bringing their concerns to their parents.
Students who aren't receiving the mental health that they need, they're not showing up to school. They're failing their classes. Their parents will call me, they won't get out of bed.
I think it's super important we have a way that we can point them in the right direction, hand them off to the experts, walk side by side with them, whatever it takes.
BRAVE stands for Be Resilient and Voice Emotions. How can we bridge the gap from students needing mental health services, particularly when they're coming from the school district, to receiving those services on the other side? And so we started partnering with the St. Johns County School District, started understanding what their issues were and where they were finding those barriers and gaps to connecting students and families to those mental health services. They were sending referrals outbound to providers and to agencies. However, they were finding that only about 35% of their students that they were sending outbound for mental health services were ever getting connected. We started building this program where we were training our staff to receive these families who were either, in crisis, they had a lot going on with their families, be able to receive those families, assess them quickly, and get them to services as soon as possible.
When BRAVE was first introduced to us, we were a little skeptical. We thought, how do they know our community so well? We know our community. But what I found is they know our community.
One of the greatest benefits of this kind of partnership with BRAVE is that they have the ability to get resources for you. They may be outside of your county, outside of your region, and that's just a great opportunity that you don't have otherwise, and you don't have the ability, the time, or the capacity to make that happen on your own.
Our goal as the BRAVE program is to be in every school district in Florida providing the services. This is a state-funded program. This is something that is going to be 100% free to the staff, to the administrators, to the students, and to the families. There is no cost.
BRAVE is just a great opportunity. It's a partnership in a community with the school, with the mental health services and other services that can help bring children forward. There's an obvious correlation between providing support to students when they're navigating tough times and helping them to emerge as successful young adults. If everyone bought into it and we made it happen, the ability to do this statewide will be a game changer for our youth. It'll be a game changer for the state of Florida.